shot anyways. So I'm Jade Hernandez. I'm the outreach coordinator with Iowa City Hospice. Just to give you a little information about myself, I've been with the company for about 14 and a half years, and my role is to come out and I meet with our care partners, usually on about a monthly basis, but it depends if we have patients on service. I usually check it a little bit more frequently. So you guys might see me if you're over on the other side in the health center or the assisted living side. I'm in there walking around and meeting with staff and checking in with families and stuff pretty frequently. If you ever see me, you guys have questions about our services or just want some information about different things we have, like volunteer opportunities, we do Honoring Your Wishes, which Kara's going to talk about a little bit later, in addition to our hospice services. Feel free to stop me, or I have my cards up here. You can always shoot me an email or give me a call. I'm here to help, so if you ever see me, just let me know. And then this is Kara. I'll let her introduce herself and get started with the information.
You need to talk into the mic.
Yeah, you need it right up there.
Talk like this. Okay, that sounds good. And feel free, if you just wave at me, then I know I'm not doing it correctly, so feel free to do that as well. So I'm Kara. I'm actually the psychosocial services clinical manager with Iowa City Hospice. I'm a social worker, and I oversee all of our psychosocial services. So like our social workers, our chaplains, our music therapists, our volunteer department, and things like that. So we do a program called Honoring Your Wishes that is under Iowa City Hospice. And it is a program to assist folks with doing advance directives. So first I'm going to kind of poll you guys to see how many of you have done an advance directive of some sort already. Okay, great. Then I can kind of get a sense for how we want to steer the conversation today. So I like to do this really informally versus like kind of a PowerPoint presentation on what things are, more to just gauge what do you have in place, what questions do you have about it, what do you feel like maybe you're missing, or what do you want additional information about, and are you interested in anything next steps, like do you need to make an appointment, do you want to update your documents, do you want to ask some questions about how things would work as far as different types of situations. Sometimes people forget about that part. They do the documents, they meet with who they need to meet with, they feel like they've got everything ready to go. And that's just kind of the first step. So we want to talk a little bit more about just kind of the application of how that looks for when and if you cannot make decisions for yourself. So I want to kind of just preface that to let you guys know that that's what we'll do today, a little bit more informally. So everybody, I'm going to just talk really quickly, a couple minutes, about the different types of advance directives, so you can kind of gauge what do you have and where do you fall into that. So you'll probably have heard the term power of attorney. So what we like to do is clarify what that means, because there is a general or a financial power of attorney, and then there's a power of attorney for healthcare, and they are very, very different. A lot of people come to us in hospice and say, oh yeah, I've got a power of attorney, I took care of that, and then they show us their financial power of attorney. And we don't really worry about that, right? We're worried about the healthcare decision making and who's making decisions regarding healthcare and services. So there are multiple things that you can have in place, and there are a lot of different options out there, and that can also vary depending upon where we live, right? So in Iowa, we have specific forms and things that apply here because of the Iowa laws, and then that's different from state to state. So just like a lot of things are different in our country from state to state, that's also true for advance directives. And then I'm going to talk a little bit about the I-post as well. Does anybody know what the I-post is? It's called an I-post. So it's a...
refrigerator.
Sorry?
It's on my refrigerator.
On your refrigerator. That's the place where we want to see it, right?
It's going to look like this. The state of Iowa are like a salmon colored form.
So that is one type of an advance directive as well. Just like a power of attorney for healthcare or a financial power of attorney are different types of advance directives, okay? So let's talk a little bit about the financial one first. Typically, we as healthcare organization and clinicians don't help people do the financial ones. We recommend that people meet with their attorney or somebody in the community. We actually make some recommendations for people to do that if somebody's looking for an attorney to do that type of a thing. But we recommend that anything financial, you meet with an attorney to do something like that. You can do something very general. The Iowa State Bar Association has forms that they provide that you can do, or you can work with an attorney to be as specific as you'd like to be in that type of a document. So please think about that too. It's a very important piece, not to forget. And then let's talk about the healthcare power of attorney. So you might hear that also called a healthcare proxy or a surrogate decision maker. We just never make it easy, do we? We have all these different terms and have similar meanings. So that healthcare power of attorney is somebody that you designate that would make decisions for you in the event that you cannot make a decision for yourself. And that can be fluid, so that can be something where maybe today I don't have the capacity to make decisions for myself, maybe I'm unconscious, and so then my healthcare power of attorney is going to be utilized. They're going to use them to make decisions. And then maybe I recover, and then I can make my own decisions for myself again. So that can be very fluid. Sometimes we have instances where maybe with a progressive illness, somebody may be making decisions for themselves and then progressively not able to do that anymore. And then we're utilizing that healthcare power of attorney more consistently or on a regular basis to make all of those decisions. So that can be very variable from instance to instance, from person to person, okay? So maybe what you've heard, maybe what you've experienced, that might be different than what somebody else has experienced in their life. So that's always good to know as far as what to expect. So with Honoring Your Wishes, it's our program that we have, and we meet with people to have those kinds of conversations. So we talk about not just completing the paperwork, that's kind of the last step of meeting with folks, but it's talking about what is going on with you, what is your situation, what's important to you, what do you want your life to look like, what kind of choices do you want to make to support what you want that to look like for yourself. And then have a conversation too about who would you choose? So some people kind of come to us and are like, I don't know what I should do. I don't know who I should use. And so we'll talk about that as well. What is your situation? Who do you trust? Because what's most important about choosing that person is that you trust them and that they know you and that they know what you would want. So that's the biggest piece. They know what you would want. So what we really do is encourage people to come to those appointments with maybe their person that they're designating as their power of attorney for healthcare decisions so that we can facilitate a conversation about what is important to you, what kind of choices would you want to make in various different types of scenarios. Sometimes people too would not, they don't know who they would pick because they're not sure, maybe they've not had some of those conversations before. And so we've done multiple meetings with people as well to help facilitate some of that. And that service is a free service out of Iowa City Hospice, and we'll meet with people as much as they would like to do that in order to kind of facilitate that process and then complete documents if they would like to do that. So before we kind of move on, are there any questions right now? Sure.
Where do the papers for Honoring Your Wishes go? Do
That's a great question. So yes, anytime you complete an advance directive, so a power of attorney for healthcare and the like, the original stays with you. And then we typically will make a list with you of where should copies of this go. You should be giving a copy to your primary doctor, any specialist that you might see, whatever your hospital of choice is, they should have that on your record. The person that you're designating as your healthcare agent, you should give them a copy in case something happens and you're not able to provide that copy yourself, then that person can provide that copy if needed. So otherwise you keep the original, but we will, if we're helping people make or create documents, we give them lots of copies to be able to have. Does that answer your question?
You don't keep one.
We do not keep one, correct. The service is just to assist with completing it. We don't actually keep any of that stuff on file in our office.
And there's a little handout up there too, in case you guys have just some general information and locations where you guys can have that completed. One thing I like to point out is if you're interested in having one of these completed by Iowa City Hospice, all you have to do is call our office and our receptionist can take your information. They just need your name and a phone number, and then they can schedule a date and time for you to come. I think typically our appointments are scheduled for about a 2.5 hour or 2 hour block.
More like an hour, hour and a half
Okay.
for that first initial meeting. But if we need to do longer or another appointment, we can do that as well.
So they don't take any insurance information or anything like that. All you have to do is get their phone number because you're not going to be billed for coming in for that.
Any other questions?
Just a comment.
Sure.
When my husband was very ill in the hospital, University Hospital, they had lost it. They could not find it. So I think it's good to have a duplicate copy with you, carry it with you when you go in. They never did find it.
Can everybody hear that? So she mentioned that in your experience, your husband was hospitalized at the hospital here in town, and they couldn't find the copy of the power of attorney that had been provided to them. So it wasn't in his record. They didn't know, right? Have that on file. So the recommendation is to have a copy of that with you. Carry it with you in your purse. Is it great for us women? Put that in your purse. Actually, as part of completing documents in our program as well, we will do a little card that you can put in your wallet that says you have an advance directive as well. Some people like to do that too. So it's always a good idea to have a copy, maybe not the original, but to carry that with you on your person as well. Thank you for that comment. Is there another one? Where can you get the iPost forms? Well, why don't we talk a little bit about what that is a little more and when we utilize them. So the form itself is something that was created on a national level. They started off with a program called POLST, P-O-L-S-T, and it stands for kind of physician's orders for scope of treatment. So what that means is what kind of treatment would you want in kind of these different types of situations. And just like I mentioned, how things are different from state to state, there is no national POLST form that you can use wherever you go. Each state has their own form that they use. Iowa's is that iPost. Would you mind passing out some of those so just people could take a look at them? So the form is intended for folks that are frail, elderly, have a terminal illness, so we use it with hospice patients, and other hospices do as well, or any person that has maybe a long-term chronic serious illness. So that can be a person of any age as well. I've got maybe one more right here. So we actually can utilize this form with pediatric patients as well that might have a terminal or a serious long-term chronic illness. So there's different corrections to this form. So it's not always appropriate for everyone, right? Where an advance directive, a power of attorney for healthcare, a living will, that's appropriate for anyone. Anybody that's age 18 and over that has the ability to complete an advance directive, we really strongly encourage everyone to do that. I did it as soon as I started my work here many moons ago, because it's just such an important thing to have, because you just never know when you may not be able to make decisions for yourself. So the I-post is a little different in that it is utilized for kind of a specific population of people. Many nursing homes, so like residents who live in a nursing home, so similar to the health center here, we want to do that with every type of resident that lives in that type of setting, because they kind of meet that criteria for the type of population that we're looking at. So what we want to know is, what are your preferences for care? So it's talking about code status, so CPR or no CPR. It's asking about other types of medical interventions, like breathing support, other types of interventions you might see maybe in an ICU or in a hospital setting. And then it's asking also about feeding tube preferences. So the big reason for the form is to document what is it that you would want, and to complete the form and then have that form be with you wherever you live. So as you mentioned, on your fridge, right? So that if an emergency or something happens and you've got, EMTs and EMS services coming to you, they can see that you have this form and that you have specific preferences that you've noted that you would want. So then they can honor those things. So the form, signing this, you sign that as the person, and then a provider of some kind, so a doctor, a nurse practitioner, a PA, then they sign that form as well. So that makes that kind of official, right? So that everybody that's providing healthcare services to you knows that they can follow that form. So it's that extra step.
So for whom in this audience would it not be appropriate?
Well, that's a great question, because I don't really know much about what you guys all have personally going on, but it's probably appropriate for more of us than it wouldn't be. Like I said, it just kind of depends too on your individual situation. We focus primarily on hospice patients, because we do that with everybody because they have that terminal illness. Folks with long-term chronic illness, and then frail and elderly. So it kind of depends on what your definition is of that, right? What we see is that a lot of the providers in the area, they know what the form is, but they don't really encourage it or ask their patients about it. So we see a lot of more implementation of the form in kind of care centers, nursing homes, assisted livings, maybe like a group home setting, memory care, things like that. Sure.
I would suggest you broaden your suggestion,
Sure.
because I had an experience in which my wife had a heart attack,
Mm-hmm.
and the first thing that the EMTs ask about is, does she have an I-post on the refrigerator?
Sure.
They are looking at the refrigerator. I think everybody in Oakville should have it.
I would not disagree with you. So his comment was he had an experience with your wife, did you say?
Yeah.
Who had a heart attack, and the first thing the EMTs asked was, does she have an I-post? And on the refrigerator, because that's where we encourage you to put it. And that the recommendation is that all of us here at Oak Knoll would do an I-post. And because you just never know when an acute event like that might happen. I think that's a very, very valid point. And actually I think it's just Johnson County, those EMTs, those emergency medical services, they are trained to ask for that. They're trained to look for it. And we work together with them to let them know that, yeah, folks in the community have this I-post. Because they're receiving care at home. And we want them to know, look for it, ask for it. So a lot of the kind of the origination, back to your original question, is healthcare providers are usually the ones providing the form and kind of facilitating the completion of it. And I'm trying to remember for sure, I think it's Johnson County, or the state of Iowa Public Health is where the form actually kind of is, is where it originates from.
Sarah Neary, who was a social worker for independent living.
Yes.
She takes care of it for you.
Yes, she is wonderful. And Kaylee in the health center as well. They are your best resources for, hey, do you think this is right for me? Can we talk about these different options? Because they're going to know more about you, right? With working here as that social worker, and be able to say, yeah, I think that's a good idea. We should think about that. And they can help you complete it as well.
And if you change your mind about any of the decisions that you make, you can have those updated as well. So don't think that just because you've completed it once, if something in your life changes and you want to make an addendum to that form, you can absolutely reach out to your provider or Kaylee or Sarah Neary, and they can help you make a new form that's updated.
And that's true for any advance directive. You can always do a new one or update the one that you have. And also for the iPost, you can do a new iPost at any time, and then we, get rid of the old one, right? And then you can have a new form.
At the end of the iPost, it says prepared by, and then it says healthcare professional preparing form. So we are not supposed to do this ourselves.
Correct.
We take it to somebody like Sarah.
Yes. So what we have actually done through the Honoring Your Wishes program is that we have trained professionals, healthcare professionals in the community to complete these documents with people. So that it's not just that checkbox, here, let's do this form, complete it and sign it. It's that conversation about who are you, what's important to you, this makes sense for you, what do you want to do, and so on.
And then it says physician is, having the signature of the physician is mandatory, so
Yes.
you take the original form to them, have them sign it, and then you keep it.
Yes. So, and that's where that healthcare professional can come in as well to help facilitate getting that signature of the provider on that form for you. So sometimes there's a delay. I know that can be true for us. It takes us a few days to complete the document, have our provider sign it, and then get that back out to the person's home or wherever it is that they're living. So that might be true here too. Maybe you take it with you to a provider appointment, or I know maybe for somebody that's in the health center, for example, when those providers come in to visit, they can sign forms when they're here.
So those white forms that you have, those are actually just a copy of this orange sheet, or whatever color you want to call this. Salmon.
I say salmon.
So if you want to look that over, review the questions with your loved one, especially if you have someone that you're going to designate for healthcare decisions. That way you can look through those questions, kind of figure out what you want your answers to look like, and that way when you go to your provider, they can help you fill out the orange form and make it official. So this white one that you have now, if you fill that out, they're going to need to make a new form and sign that, and they're going to do that on that bright form that you're going to keep in your location, which is typically the refrigerator. So that way they're all universally the same color. Those white papers can get overlooked very easily, so they want a nice bright color that those EMS people will see when they come in.
I have a question.
Yeah.
So a few years ago, I signed one of these, and it's in the computer at University Hospital.
Sure.
So now, I fully see a vision for putting it, but this doesn't, those would have to be almost very compatible. I can't remember what we put on the earlier one. So which one would be more accessible to emergency people? This one, really.
Yes.
is taking,
Yep. So she's making a comment about how you completed one, maybe you have that in your home with you, but maybe you've also provided a copy to the hospital, and maybe it's, because we see that too, right? It's in the EPIC chart, maybe at the University Hospital. And so that's where some of those logistics have come in with the actual implementation of iPost and how does that actually work. Because the intention is for that iPost to go with you wherever you go, which might be at home, it might be to the hospital, but we all know how that goes, right? They lose things. They get misplaced, they don't know, somebody doesn't know what it is, it gets lost, it never comes back home with you, and so on and so forth. So healthcare providers, hospice included, will have a copy of that and have that in the chart electronically, so scanned in. So there's always kind of that process of making sure that what we have on file is current to what you want it to be, and then how is that accessible to people. It's a barrier sometimes. It's kind of a logistical process that we always have to work on. But that's a great question because it all sounds good in theory, right? Until you try to actually do it in real life. Yeah.
Sort of like
Sure.
you want to have a tattoo on your chest or something.
Right. It's funny you make that joke, but we've talked about that in hospice. So, you know, it's like, oh no, make sure you put that DNR right here on my chest so they know what I want. It's a joke because there's some truth to that, right? That's why this is all so important, big picture, is because in the healthcare field, the inclination is to treat. The first reaction is always going to be to treat. If they don't know what to do, they're going to err on the side of caution and they're going to do everything. And maybe that's not what you want. That might not be what I want. So I want to make sure that I have everything in place that I can, the advanced directives, a power of attorney for healthcare, an iPost if that makes sense for me, and then talking to the person that I designate as my person to make decisions for me. Do they know what I would want if I can't tell them what I want? I always give this example with my husband. He's a physical therapist, and he's always been like, oh, hospice, okay. And there would be things that I've had to make sure, do you understand that I don't want this? Do you understand that I don't want this? Because if you have to make that decision for me, you need to make that decision, not what maybe you think you want for yourself. You need to make the decision that I want. So we've had to have that conversation a few times. And that's an ongoing thing. So we really strongly encourage you to have that conversation with whomever you're designating as your power of attorney for healthcare. You can't write out every single scenario. You just can't foresee what might or could happen. So it's important that they know what's important to you, and what kind of decisions that you might make. Sure.
So does it often happen, or have you had the experience of people saying for decades, no, I don't want to be resuscitated, but then at the very last part of their lives, they change their minds?
Sure. So the question is, do we see a lot of people that have said for a long time that they don't want to be resuscitated, they want to be a DNR, but then at the end of their lives, do they change their mind? Hardly ever. I've worked in hospice for almost 15 years now, and I could probably count on one hand how many times somebody has changed their mind in that direction. Most of the time what we see is that people are either undecided, or they would want certain things in certain situations, or they would want certain medical interventions, for this or for that, but maybe not for something else. And as they kind of progress or get closer to end of life, they tend to stop doing much of anything. And then we'll transition from CPR to wanting to not be resuscitated. So the overwhelming majority, as we see, is that. And I think that comes from just the support and the education and that awareness, and not just the physical medical support that hospice provides, but all of the psychosocial support that we provide. So the spiritual support, the emotional support, the education about what to expect. A lot of people are either afraid or anxious or concerned about things when they don't know what to expect. So getting that support going can just help people, what I say is make better informed decisions. Yes?
I was also going to say that in that list of people who you might consider giving a copy of this to,
Sure.
Oaknoll is happy to have a copy of the advanced directives.
Yes.
In the licensed area, it's a requirement. In independent living, it is not a requirement, but it is encouraged. It's nice. It won't go missing from your Oaknoll
Sure.
file. So if you need it, or you're wondering what decisions you made and whether or not you want to change it, having that copy on backup is
That's great. Could everybody hear that? It's if you're living in kind of a more structured setting, like assisted living or something like that, at Oaknoll, for example, is happy and want you to provide a copy of your documents, your advanced directives to them, because that helps them better serve you. It helps them better support you and make decisions that are in line with what you want. So yes, thank you for pointing that out, because we will also mention that to people when we're making copies for them. Where do you live, and do you need to provide anything to a place where you might live? Yes?
To get this all made out, we both have family on the East Coast.
Sure.
How do we manage with that?
Sure. So as far as maybe providing them with copies, or maybe because you're going to travel there?
We're going to be traveling there, yeah.
Sure. So we do get this question sometimes, especially for snowbirds who will go spend several months or weeks in the year in a different location outside of Iowa. That's a very legitimate, good logistical question. We actually have started to err on the side of recommending that you do something in that state as well. So the power of attorney for healthcare form is pretty easily transferable. If I do the Iowa State Bar Association form for a power of attorney for healthcare, have pretty good faith that that's going to be honored in other states. The I-Post, though, is a little different, because each state has a different type of form that is like that. We recommend that people find out what is acceptable, what is preferred in their state that they're also residing in, and do something there. And if you stay in a certain location, if you maybe see a provider, a doctor or somebody in that location as well, to then provide copies of documents to them as well.
Would travel agents have that ability to copy one off for you for a state, do you think?
A travel agent?
Yeah, they're like, if you were going someplace, you might be able to say to them, I want a copy, I wonder if they can.
Yeah, I'm not sure that they would know. I just don't know if they have that expertise or not. Some of them may, but I'm not sure that's an expectation of travel agents. If you have family in a specific location, it might be better to find out, from maybe their healthcare provider, or if they're connected to a healthcare system, start there with either their provider or maybe a social worker. That's a really great logistical question. A lot of travel.
I don't know if this is likely to happen at our age, but in the past, we have done some traveling out of the country.
Mm-hmm.
How does that work?
That's another great question. So anything that you do in the United States is not going to be transferable or accepted in another location for a couple of reasons. The language barrier, for one thing, and if something that's going to be written in English, and the other thing, just because you're on foreign soil and you're no longer in United States territory. So we recommend We recommend that people travel with a companion, right? Have somebody with them that can speak for them if needed. But to also, we recommend that people talk with their healthcare provider as far as any recommendations that they may have specific to you and your own unique needs. Somebody might be more prone to certain types of problems depending upon their medical history. But ultimately, we tell you to bring a form with you, bring a copy of any advance directives with you if you're going to travel. They just may not always be able to be utilized because they'll be in English. Hopefully you're encountering a place where somebody is able to read English, or interpreter services that might be available. For example, maybe you're receiving health care at a different location. Great questions. What other things? Anything else that you came here today hoping to hear about, or questions that you had in the back of your mind? I'm not sure what time it is. I was just telling Jade I don't wear a watch, and I should. Because I don't always have pockets for my phone.
3:07.
Okay, so we've got some time if you have some additional questions.
Is anybody in here an attorney? Is there an attorney in here?
Any
I have a
attorneys?
question for an attorney, but it's not, okay.
Sure.
One of the questions that I've been asked when we've done these at other locations is, can you have,
one of the things that I've been asked when we've done this informational visit at other locations is, can you have a different person in charge of your living will, which is like the financial part of it, and a different person for the healthcare part of it? And absolutely yes. My parents have always joked around that when it comes to their healthcare decisions, they do not want my brother to be in charge. They left the financial part up to him. Just because I work in the healthcare field, and they knew, they could tell me what their decisions are, and I would make sure that those were followed exactly the way they want them to be. So that's one thing that you can take into consideration when you're thinking about it, especially if you have multiple kids, or maybe you don't have any kids and you're trying to choose a different family member or a friend, but that can be two different people.
Thank you, Jade. That's a great point. And we sometimes get questions too about, well, can I designate both of my kids? Or, well, I have 3 children and I don't know how to choose which one. We don't make those decisions for people, but we do make recommendations, and we really strongly encourage people to try to choose one. And that's hard for some folks. The reason that we do that is because if you designate more than one, and you use language that says and, so my son Bob and my daughter Jane, then they have to agree. And no decision can be made unless they agree. And so that sometimes can cause trouble, because not everybody always agrees. So we do strongly encourage people to try to designate just one person as their primary person that would make decisions for them, and then to consider an alternate. That way, in case that person can't do it, or maybe they say, oh, now all of a sudden I have to do this, I really don't know if I can, then you have an alternate or a backup person. If somebody does not have a power of attorney for healthcare, there is an Iowa law that states kind of a decision-making tree where, okay, if you don't have somebody, then the first thing that they look at is, does that person have a spouse? And so then that spouse would be the decision maker. If they don't have a spouse, then they move to the majority of adult children. So already you can guess what I'm going to say. When you have a majority, how do you determine a majority if you've got an even number? Because 2 out of 4 is not a majority. So there's ambiguity, there's ambiguousness in the law. And when you have to have a majority of more than one person, then you, again, run into the issue with people needing to agree on what to do. And sometimes that goes really smoothly, but other times it does not. And that can be really difficult, especially if difficult decisions need to be made, or decisions need to be made timely or quickly. So consider that. Many of you already have completed documents, but think about that for yourselves. Okay, what other questions or comments? Okay, again, the social workers here, Kaylee and Sarah Neary, are wonderful resources. They're both very familiar with hospice as well. So if you even have just questions about hospice, you can ask them, and they're just a great resource for you guys.
Could I ask how hospice fits in with the Oakville Health Program?
Sure. So hospice generally is intended for any person that has a 6-month or less prognosis. And so that could be any kind of disease process. That might be somebody with cancer, heart disease, lung disease, etc. And hospice is in addition to whatever somebody might be already receiving. So if you're living in a nursing home and they're taking care of you, 24/7, hospice is in addition to that. It's considered a specialty. So just like your cardiologist is a specialty and they're most concerned about your heart, right? Hospice is a specialty. So we provide that expertise about end-of-life care and what that looks like for people who are dying, no matter what their disease progression might be. So it's nursing visits from those psychosocial staff like a chaplain or a music therapist or a social worker, aid visits that might come help with a shower or bath. All of that is in addition to what the person is already receiving, say if they're living in a nursing home or in assisted living. And it's to provide that expertise and that coordination of care, because that just looks different for somebody that's dying versus is living.
Just so you know, if you are on Iowa City Hospice Services, you will continue receiving the cares that you're receiving through Oakville right now. So for example, if someone's in the health center and
if someone's living in the health center and they're getting, let's say, baths twice a week with their aides down there, and they have a nurse that's down there that's doing their medications down there, you're still going to receive all of those things. But in addition to that, you're now going to have Iowa City Hospice come in, and you're going to have a nurse that's assigned to you with Iowa City Hospice. And our nurse is going to work with the Oakville nurse. They're going to talk to your primary care provider. That might be through the university. It might be through Mercy Hospital. That way, all of us are working together to coordinate that care. And in addition to the baths that you're getting from the aides here at Oakville, we also have our aides that can come in. So maybe you get getting a whirlpool 3 to 4 times a week instead of just twice. So then our aides can come in twice and they can give you that extra time. Instead of, being kind of in a rush because there's a lot of people on one hall, our people are here to specifically spend time with you during their, hour aid visit to do what you need to do. So if you want to take a bath, you can. If you want to get your nails done, they can do that. If you want to get shaved, that kind of stuff. So it's just that extra special time that you get one-on-one with a hospice specialized employee. And we also are experts in pain management because we want to make sure that people at end of life are as comfortable as they can possibly be. So we're specialized in using specific medications and working with your providers to make sure that you're getting what you need.
Thank you. That's a good question. Yes.
How does where does palliative care enter into this thing?
Yes, thank you for asking that too. Palliative care is kind of a more recent term in the last 5 to 10 years. And it's more of a kind of an overall umbrella term. So palliative care means specialized care for the management of symptoms. So you can do palliative care in conjunction with specialty care or kind of ongoing care for a chronic illness. So for example, you're diagnosed with cancer, you're going to your oncologist, they're providing you your cancer care. But you can also see somebody that is specialized in palliative care that works with that curative provider to help make sure that, hey, well, what's important to you? What kind of goals do you have? Yes, you want to have treatment for your cancer, but you also want to feel well. and not be burdened by all of the things that can come with that treatment. So it's actually designed to work in tandem together. And palliative care is more holistic, where they look at that whole person, what's important to them, what are their goals, what do they value, and kind of balancing that with then that curative treatment, okay? Hospice is a type of palliative care that is intended for people that have that 6 months or less prognosis. So, very good question. It's not clear kind of in the general community what those differences are. Okay. Any other questions? Wonderful. Okay, I think Jay brought some cards, so if you wanted to take those, you can certainly do that. And one last thank you and reminder that Kaylee and Sarah are great resources for that, and even if you just wanted to get connected with us, you could do that through them as well. So, and we'll be here for a little bit, so if you had anything else that you think of as you're gathering your things, then you can see us before you leave.
Thank you.
Thank you all.